Okay, last week I think we finished until Qi deficiency, 25 Qi and 25 blood formula. This week we continue to 25 formula. So next week is the midterm, like a second midterm exam. Okay, so from the first part of the formula, right? So yeah, Qi deficiency, blood deficiency. Now both Qi and blood deficiency. Ashley, can you read this page, please?
Tonify the qi in blood. Bazin Tong, 8-herb powder for rectification. Ren Shen Shu Di Bazu Fuling Dengui Baishao Zigan Kao Tuan Xiong Dazao Shen Jiang. Pallid or shallow complexion, palpitations with anxiety that may be continuous, reduced appetite, short of breath, laconic speech, easily fatigued extremities, lightheadedness and or vertigo, a pale tongue with white coat, thin and frail or large, deficient and without force, concurrent deficiency of qi and blood. Qi guan dabu tang, all-inclusive great tonifying decoction. Bazin tang, huangji rugui. Wan complexion, fatigue, reduced appetite, dizziness, listlessness, dyspnea, palpitations, spontaneous sweating, night sweats, cold extremities, spermatoria, often seen in consumptive disorders with coughing, weakness in the lower limbs. Qi and blood deficiency with mild yang deficiency, thin, weak, deep, possibly slow.
Thank you. So yeah, this qi and blood deficiency or qi deficiency or blood deficiency, it is quite tricky to differentiate. Again, I mean, we are not really studying whole formula, but we try to understand how we can differentiate between those formulas within the same category or within same signs and symptoms. So that you have to more focus on, okay, how can I tell this Bajan Tang versus Sichuan Dabu Tang, or like a Guipi Tang, or a Jigan Chao Tang. So yeah, this is pretty close. I mean, many signs and symptoms are together there. So what is the key things to differentiate? That's what you have to focus on and kind of summarize like that and study like that. You don't have to I mean, basically this qi and blood deficiency. So they are very common signs and symptoms with all of those. But what makes this different? So that's what you have to focus on. So first, the Ba Zhen Tang, right? This Ba Zhen is 8 powder. First of all, there's like another famous formula, Ba Zheng San, that we're going to study in the second part of this formula. This is damp heat in the bladder for urinary difficulty. This is Ba Zhen Tang, similar pronunciation, so be careful. So this is basically tonic formula for tonify spleen and lung qi, and the liver blood deficiency, right? Or liver blood. So basically, qi and blood deficiency, qi of the spleen and blood of the liver, because Si Jinji Tang is a spleen qi deficiency, or spleen and lung qi deficiency, and Si Tang is a liver blood deficiency. So This complexion is pale, and palpitation with anxiety that may continuous. So this is, we're not getting that yet. So we talked about Bajantang. So yeah, this is what when you compare Guipitang also say Qi and blood deficiency. So how can you differentiate between Bajantang and Guipitang? Okay, so we're gonna take a look after we go over the Guipitang. So, and the reduced appetite, like a shorter breath, laconic speech, fatigue. This is all Qi deficiency signs and symptoms. Right? And some lightheadedness and vertigo is blood deficiency. Pale tongue, white coating, and very deficient pulse without pulse. So typical, but the person tongue. So this is a concurrent Qi and blood deficiency. So what you have to understand is this is spleen, Qi, and the liver blood deficiency. So they may have more signs and symptoms, probably more physical symptoms of liver due to liver blood deficiency. Okay, Showman, we are getting there. Okay, so yeah, you don't have to explain all of this yet. Okay, just wait a minute. And Suchuan Dabutang is a kind of variation from Bajantang. So again, this is Renshen, Baizu. So this is more like Sijinjutang, Qi, and Suri. Dangwei, Baishao, Chuanxiong is Siwutang. Whereas Sichuan Dabutang is same as a Bajantang, but just add Huangqi and Rogui. So Huangqi is strengthening more Qi and Rogui is more warming, because this patient is the same as the previous one, having all the deficiencies, but a little bit of the yang deficiency, towards the yang deficiency. So that indicates that Qi is deficiency. If Qi deficiency is getting chronic, then one of the function of the Qi is warming, right? Yang. So now that is going to decline. So yeah, this is having the same signs and symptoms. There's nothing much different, but they have some yang deficiency, of cold extremities and the weakness of the lower limb, and some spermatoria. So this is more likely the cold signs and symptoms, kind of mild, but together with the Qi and blood deficiency. So this is Qi and blood deficiency with mild yang deficiency. Okay. So that was on the exam before. At that time, they compare Sichuan Dabutang versus Shenchuan. Okay. So how can you differentiate Sichuan Dabutang plus Shenchuan? Shenchuan is kidney yang deficiency. So those are the things that you have to more focus, because again, just read this. Sometimes it is difficult to differentiate, because there's more of a degree of the severity is always there. When you really see the patient, you have some sense that this is severe, or this is already mild. It's not that bad. So you can decide, but by writing, this is kind of tricky to differentiate between those. So this again, Bajantang is spleen Qi and liver blood deficiency. We know what is the signs and symptoms of spleen Qi deficiency, and we know the signs and symptoms of liver blood deficiency. Put them together. That's what Bajantang makes. But Sichuan Dabutang is with that plus mild yang deficiency. So something like a cold or weakness. When we look at the Shenchuan later on, they are more severe, more focused on the yang aspect of the body rather than Qi and blood. So we'll see when we go over there. Okay, so first two, Bajantang and the Sichuan Dabutang. Okay. And next one, this is one of the most popular formula in the clinic, right? Guipitang. Donna, can you read this page, please?
龟皮汤、黄芪、人参、白术、炙甘草、茯苓、酸枣仁、龙眼肉、木香当归、栀圆子。For forgetfulness, palpitation, insomnia, DDS, anxiety and phobia, feverishness, withdrawal, reduced appetite, pale and wan complexion, pale tone and weak pulse, may be chronic bleeding. Spleen Qi deficiency with heat blood deficiency, restless, her spirit, Qi and blood deficiency, inability of the spleen to control blood, heat, heart, long-term memory, spleen capacity of any short-term.
Okay. So Guipitang is again similar to those of Bajentang. They do have 25 Qi, same as a Sujunjutang here, right? This Sujunjutang, but the blood part is more heart blood. So that's why we say like this is spleen student formula, because student used to be hard work, thinking too much, worry too much, spleen Qi is deficiency, and then spleen Qi cannot produce the good Qi, then it damages heart blood. So spleen Qi deficiency with heart blood deficiency, very typical students' manifestation. So the Sujunjutang is the same, but instead of the Su-Tang, like Suri, the Chuanxiong, Dangui, Baixiao, they just have a Dangui and Suanzao, Longyanro. So they are all, and the Fuling, they all like go to the heart and nourishes the heart and open the heart orifice like Yuanji. So yeah, this is the difference between Guipitang and Bajangsan. So, and since this is blood, like heart blood, more emotional problem like forgetfulness, palpitation, insomnia, dream disturbed sleep, anxiety, phobia, feverishness, withdrawal. This is Qi, like a withdrawal, reduced appetite, like that. So basically same as Qi and blood deficiency, but they are more like this emotional problem than Bajangsan. And another thing that you have to remember is this bleeding. So one of the function of the Qi is to hold the blood in its vessel. So specifically, Guipitang is known to be effective to stop bleeding, especially heavy menstruation bleeding due to Qi deficiency. This bleeding is not due to the blood issue. This bleeding is due to Qi issue. And so Guipitang is so restless heart spirit, like a Qi and blood deficiency, and the inability to spleen to control the blood. Okay, so this is like Guipitang's main treatment area, and especially like forgetfulness, cannot concentrate, This is Guipitang's problem. So, like a spleen is there's three organs are involved in memory issue. Spleen is the capacity of memory. Heart is responsible for the long-term memory, and kidney is short-term memory. So usually that this is spleen chi deficiency. You're like this is important for the student because this memory is that you listen, you understand, and process to make this information available. So if spleen chi deficiency, that function is limited, so that easily you forget, you cannot concentrate. So this is spleen chi's function of the memory. So now, when there's a case like which one you choose between Bajengsan and Guipitang, if they just chi and blood deficiency, it is difficult to differentiate. But they will give you something like a bleeding, or this many more like emotional issues, or like rather like a menstruation pain or pale nail like that, or like falling hair easily. This is more Bajengtang case. Right? And if there's a cold signs and symptoms with all of this deficiency, this is Chandabuta. Okay. So yeah, those are like first three. So again, this is all chi and blood deficiency. So basic chi and blood deficiency is Bajengsan, right? So with liver, blood, spleen, chi, and the Guipitang, liver, spleen, chi, and the heart blood. Sichuan-Dabutang, Bajengsan plus the Huangqi and Rogui, so a little bit of yang deficiency. Next is Jigan Chaotang and Taishan Panshirsan. Melanie, can you read?
Yes.
Go ahead.
Durgansatang, honey fried licorice decoction. Durgansao, Renshen, Shenjiang, Dazao, Guizhi, Zhengdi, Yijiao, Maidong, Homaren, crush, Yijiao, dissolve in strain decoction, indication, palpitation with anxiety, irritability, insomnia, loss of appetite, emaciation, shortness of breath, constipation, dry mouth and throat, irregular or weak pulse, qi and blood deficiency. Taishan Pan Shisan, powder that gives the stability of Mount Tai. Renshen, Huangqi, Baizhi, Jigantao, Donggui, Chuanjiang, Baishao, Shudihuang, Shuduan, Huangqin, Shaoren, and Numi. Indication: restless fetus, threatened miscarriage or habitual miscarriage, pale complexion, fatigue, lack of appetite, a pale tongue with a greasy coating, a rolling but forceless pulse, qi and blood deficiency with lack of nourishment to the fetus.
Thank you. And Jigan Chaotang is Jigan Chao is cheaper, and the Renshen. So yeah, like a 25 chi, original chi, Sengjang Daja is typical. And also nourish in part like a Sengdi, Hejiao, Maidong. Yeah, so this is like more of a nourish in aspect of the blood and heart, nourishes the heart like a Sengdi goes to the heart. So this is again all like a qi and blood deficiency. Palpitation with anxiety, irritability, insomnia, loss of appetite, emaciation, short of breath. So this is all, you cannot differentiate between this and like even Bajengsan or Guipitang. But key here is the irregular and or weak pulse. It's more irregular pulse because this is what this formula is for. So their pulse beat is not stable, irregular. And then, yeah, you choose this Jigan Chaotang. Okay, so basically, they have all the signs and symptoms of qi and blood deficiency. But if you see this pulse is irregular rather than weak, this is what you choose. Yeah. Humaron you question urge dissolved in strain decoction. This is like what is decocting method. So again, basic formula is 바정산. If there is a cold, 수천다부터. If there is like a bleeding, you got what the 구이피탕. You have a irregular pulse, you have a 지간차오탕. Okay. So for exam is more like give you a clue that you can differentiate. Okay, because they just give you all the signs and symptoms of chi and blood deficiency, and they don't let you decide which one because there's no way you can choose it. Right? And another one is a Taishan Panshilsan. So this is same like a Röntgen, Baizu, Ganchao. This is the Sijinjutang and Dangui, Chuanshong, Baishao, Suri. This is Suutang. So they have a Ba Zheng San there, right? Tonified Chen blood, except fooling, because this goes to the like a fetus. And so yeah, the fetus usually you don't use fooling because that is more like a deleting, right? Or like a dissolving. So all the 8 Ba Zheng San minus fooling, but they add some benefits for the fetus, like the Shudan, Pangchin, and Sharon. So they all helping the fetus of the like strengthen the yang and the muscle, clear heat, and like dissolve this like dampness. So yeah, this is the similar. They have all the signs and symptoms of chi and blood deficiency, plus this restless fetus, threatened miscarriage, or habitual miscarriage. So something to do with like with the fetus, okay, and plus pale complexion, fatigue, and lack of appetite. So pale tongue with greasy coating and rolling, but forceless pulse. Do you know why it's rolling pulse here? Why habitual miscarriage have a rolling pulse, do you think? Rolling pulses. Rolling pulse is slippery pulse. It can have a phlegm, but it's like this indicates this patient is pregnancy. So yeah, this has no clear signs of the dampness, but phlegm and damp. But yeah, this fetus, like the key treatment pattern is chi and blood deficiency with lack of nourishment to the fetus. So yeah, you feel those little of the greasy coating and the forceless pulse that indicates this patient is a pregnancy. So these 5 formulas of chi and blood deficiency. So first of all, you have to identify there's a chi deficiency part and blood deficiency part. Chi deficiency is mostly the same because usually it is like a chi deficiency of the liver and the spleen and the lung. Is lung deficiency is cough, short of breath, like that. And the spleen deficiency is lack of appetite, like weak limbs and loose stool, like that. So this is a typical chi deficiency, number 1. But blood deficiency is quite clear differentiation between heart blood and liver blood. Of course, both of them can cause insomnia, can have anxiety, but liver blood is more physical issues like stiffness of the muscle and the tendon, and like late menses, pale nail, the short, scanty menstruation like that, with like falling hairs, those and tongue, like on side pale like that. This is typical liver blood deficiency. Whereas heart blood deficiency is more mental, emotional thing, like more on the anxiety, higher, like a dream disturbed sleep, palpitation, forgetfulness, cannot concentrate, easily startle like that. So you can. So again, on the exam, they will give you something that you can identify. Okay, because as long as you can, you see the case and then you can catch it from there. Yeah, you're not really having a problem to differentiate between those. So Bajangsan, and then if you see any like a score. Sichuan Dabutang is you have to differentiate between the yang deficiency of Jingui Shenchuan or Shenchuan. What is the difference? We'll take a look after this. And the Guipitang is, remember, the bleeding. They usually give you this heavy menstruation bleeding because of deficiency. If there's a also you have to differentiate that like heavy menstruation bleeding due to excess heat, Jingwan, right? So that we're going to study in the second part. So those are between the menstruation bleeding, you have to differentiate between excess and deficiency. If that is more like irregular heartbeat with the Chen blood deficiency, we use the Jigan Chaotang. And if that Chen blood deficiency caused the habitual miscarriage, this is Taishan Pan Shilsan, because this miscarriage can be caused by blood stasis. So usually use Gu is a fooling one, or you miscarriage due to cold, like a Wenjing Tang like that. So we're gonna review this like this menstruation problem formulas later when we study this basic blood stasis formula, because there's so many blood stasis or menstruation or infertility related formulas. So you should be able to differentiate between those two as well. Okay, any questions on this Qi blood deficiency formulas? Okay, so now you can you can differentiate between them, right? Okay, good. Yeah. Thank you. So now looks like most of you here. Let me see who's not here yet. Ashley, Donna, Melanie, Rosemary, Centuria, Sherman, Vincent, Vanessa, Vincent. Right. Let's move on. Okay. Next category is nourish in. Okay, nourish in. So, Centuria, can you read this page, please? Centuria, can you read? No problem. Okay. Sherman, can you read this page, please?
Lue Diwangwan, 6-ingredient pill with Romania, sore and weak lower back, lightheadedness, vertigo, tinnitus, diminished hearing, night sweating, spontaneous and nocturnal emissions, red tongue with little coating, rapid and 30 pulse, maybe 5 palm, chronic, dry, sore throat, toothache or wasting and thirsting disorder, kidney and liver yin deficiency. Half of the formula is divided into tonifying herbs and the other sedating herbs for balance. Kidney, Shuriwang, and Zexia. Liver, Shanzhangyu, Mudinpi. Spleen, Shanyao, and Fuling.
Thank you. Lue D11 is another very common formula we prescribe in the clinic because I think probably at least 50%, 60% patient having underlying kidney insufficiency, right? So either Lue D11 or Lue D11 modification is very common formula we prescribe or we use in the clinic. So yeah, this is liver and kidney insufficiency. Well, in a sense, like liver, spleen, kidney insufficiency means 3 lower leg in channel organs insufficiency. So sore and weak lower back, lightheadedness, vertigo, because this In's deficiency not nourishes the brain, you have this lightheadedness and vertigo. This is deficiency, not excess, right? And tinnitus, this is, what kind of tinnitus? Low pitch, high pitch? Is opposite. So deficiency, low pitch tinnitus. Excess, high pitch tinnitus. So how can you tell? Usually low pitch tinnitus, you cover your ears, that tinnitus is diminishing or disappearing. Whereas high pitch tinnitus, you cover the ears, still your tinnitus is not getting any better. So yeah, kidney insufficiency is tinnitus. Liver fire or liver young rising, high pitch tinnitus. Then you may ask, liver young rising is underlying kidney insufficiency, kidney liver insufficiency tinnitus, and liver young rising. Then is it high pitch or low pitch? Yeah, but patient is liver young rising. Yeah, usually that is more high pitch because even though underlying is deficiency, but the actual patient is excess condition of liver young rising. So usually it is more high pitch. So yeah, I mean, if you see the patient in the clinic, they complain about tinnitus, they usually high pitch, even though they are in deficiency or blood deficiency. So that means that this patient tinnitus is more liver young rising, not just deficiency or not just excess. Right? So this is a low pitch tinnitus with that diminishing hearing. So gradual diminishing hearing. Excess, like liver fire, sudden loss of hearing, like that, right? So always excess is more sudden, whereas deficiency is gradually, chronically. And here we have like a typical night sweating, afternoon tidal fever, and spontaneous and nocturnal emission. Right tongue with little coating or no coating. Rapid thready superficial pulse. And maybe 5 palm heat. So 5 palm heat is another typical liver insufficiency heat. And chronic dry and typo, sore throat. Why there's a chronic sore throat for kidney insufficiency? So why specifically throat? Actually, you have correct, half not correct. It is heart. The kidney channel ends at the root of the tongue, where that you're like typically complain dry throat and sore throat. Usually like old people getting dry throat, and the sore throat, the itch throat complaint because of this kidney in not reaching to the throat, because this the end of the kidney channel. It's not the same as heart though. Heart is not going to the heart goes the side of the throat, but not really that specific throat. And the toothache, why toothache? Why toothache? Toothache? No, actually, it's kidney. Kidney governs the bone, right? And tooth is the extension of the bone. So that's kidney. The toothache is that connection. And with the heat, insufficient heat, there's more achiness there. Wasting and thirsting disorder, more like a diabetic condition. So this is general kidney and liver insufficiency. So this is just few of them, right? So if you understand insufficiency, you can treat with LuA-D1. And LuA-D1 is very well balanced formula because there are 6, right? Liu means 6. There's 6 taste ingredients. So Sudiwang, very sticky, cloying and the nourishing in of the spleen, kidney and the liver. But they have because this is sticky and cloying, because that nourishes the kidney in. So Jiuxie can clear those damp pitting with heat because of this warm nature, and kidney insufficiency has some heat sign too, right? Sudiwang is kind of heat, warm. So Jiuxie is very good kind of a balancing herb to clear heat and with the dampness, right? So that the only good part of the sudi can nourish the kidney in. Sanjui goes to the liver, and the Mudampi also clear heat in the liver. Okay, because this is all insufficiency and there's a heat sign, right? So these herbs are rather warm or kind of neutral, and this was kind of cool or a little cold, that counterbalancing of those nourishing element by balancing those excess heat already, because insufficiency already have existing heat, plus those warm herbs aggravate but they can counterbalance those warming things. So remember, this is a pair: Suri, Jixie, Sanjui, Mudapi. They go to liver. Shanyao, Fulling, the spleen. So that's why Luedi-Wang, it is pretty safe formula, and you can take it for long term, right, without any side effect. So this is benefit of this Luedi-Wang compared to the other Joge-1, Joge-Win, or other strong the nourish-in formula, right? And the others are variation of the modification of this Luedi-Wang. So first one, Luedi-Wang plus Uweizi. Do you remember what is Uweizi is good for? Do you remember this Uweizi? Uweizi is actually, they cannot exchange and the sweating, so go to the lung as well. So they help the cough, and it's good. They can stop sweating and nourish in and stop cough. So this is chronic wheezing disorder due to indeficiency signs and symptoms. So not any chronic wheezing. Wheezing can be caused by extreme wind, like a ma huang tang, like the xiao long tang, like that. But this is chronic wheezing, or like a weak lung, like cough and wheezing, like a more asthma patient who are already short of breath and being wheezing with little exertion. So little exertion means with little bit of those exercise or walking, short of breath, and the wheezing and the cough. So then with the insufficiency signs and symptoms, this is important. So that then you have like the same, the red tongue, like a no coding or lack of coding, rapid sleep, rapid thready or superficial pulse. Those 2, Qi, 1. Okay, just add one herb, have some extra function, indeficiency with lung deficiency. Because the kidney in is not nourishing the lung qi and yin is going to be deficient as well. And another formula is a qi ju di huang wan. So same like Liu Wei di huang wan, this is for di huang means su di huang, and add qi ju is a go cheese and juha, 2 more herb. So do you remember what is good for go cheese and juha? Goji berry, right? They're very, very common herb for the Western celebrities too, right? Goji berry and juha, chrysanthemum. Yeah, they are eyes, right? So to add goat cheese and juha to Liu Wei Di Wang, right? So that is still underlying kidney insufficiency with of this diminishing visual acuity, photophobia, tearing, exposed draft, or painful eyes. So this one, depends. This patient, you may use this for cataract patient. You may use this for the degenerative, the macular degeneration type of patient, if the underlying condition is kidney insufficiency. With those their vision is getting weaker, or even sometimes narrower. You can, or you have very sensitive to lights. This is typical cataract patient, so you can use this Chuju Diwa because this is also pretty safe formula too. Right? So this is another variation of Liu Wei Diwa. And Jiu Bai Diwa and Zhu Gui 1. Mm. Mia, did you read? Can you read this speech, please?
Zhibai di Hongwan. Add zhimu and huangbai to luwei di Hongwan. Use salt fried ones. For yin deficiency with vigorous fire, consumptive heat, or steaming bone disorder characterized by night sweats, a dry mouth and tongue, and a large pulse only in the rear position. Zhou Guiwan. Shu di shan yao go jitza shan zhuyu chuan nu shi tu cizi lu jia jiao gui ban jiao. Lightheadedness, vertigo, tinnitus, soreness and weakness in the low back and legs, spontaneous and nocturnal emissions, spontaneous and night sweats, dry mouth and throat, thirst, a red shiny tongue, and a thready rapid pulse, kidney deficiency with depletion of essence and marrow.
Thank you. Jibai Diwan is like a Jimu Huangbai, so same Diwan, but you add Jimu Huangbai. Jimu Huangbai is typically a clear deficiency heat. In this case, the Jimu is used for the deficiency heat. Huangbai clear dampening the lower jaw. So this one is patient has a kidney insufficiency, but like a deficiency heat is more excess. There's something a little bit you have to, so your judgment is important in this case. That is, can I use just Luei D11 or Jibai D11? Because Luei D11 has an indeficiency, there's some like a deficiency heat, but that heat is cleared or resolved just to nourish more in. You don't really have to clear heat. So that we use Luei D11. Whereas sometimes patients elevate the indeficiency, but heat is more excess condition. So that means the tongue is very red, pulse is quite rapid, and patients like a red face, swelling is very severe, hot flush is getting worse like that. So that heat more agitate, like a menopause, severe menopause. So women like that, we thinking to have a Jibai D11. So add Jimu Huangbai to Luei D11. So this is indeficiency with vigorous fire and consumptive heat, steaming bone disorder characterized by night sweat, dry mouth and tongue, large pulse only in the rear position. So this steaming bone disorder, this is kind of just forget about this. This is just think about kidney insufficiency with excess fire. Based on Giovanni's definition, Luei D11 doesn't have to be a red tongue, a normal tongue, right? The pulse is not going to be rapid. Whereas the Jibai D11 is more red tongue and rapid pulse. And you have some like irritability, anxiety, severe night sweating, hot flush. If you see those things, you choose Jibai D11. Zhu Guiwan. Zhu means left. So left means left kidney, means in kidney. So this is Su Di Shanyao Go Cheese Sanjue. This is a chief herb. But the interesting thing about Zhu Guiwan is animal product like Lu Jia Jiao. This is gelatin from the antelope, deer antelope, and Guiban Jiao. This is also gelatin from the turtle shell. Usually this animal product is in there, more severe. Condition is more quickly developed and more severe condition. So here, lightheadedness, vertigo, tinnitus, sore weakness to the lower back and leg, this is all the same, right? Spontaneous nocturnal emission. But this is more like a nocturnal emission, this essence issue. This is more severe and we did more like a shiny tongue means more severe insufficiency. The shiny tongue is no coating. And the thready rapid pulse. And this is kidney insufficiency with depletion of essence and marrow. So usually, just looking at the signs and symptoms, again, it's not really easy to differentiate. But usually they have some situation like a patient had, let's say, have a very long-standing illness with fever, like AIDS like that, and then have like now all the signs and symptoms of insufficient heat plus this nocturnal emission like that. So very severe condition with like kidney insufficiency heat, you can choose JOOC-V1. And this is not good idea to use long term, like rather short term remedy. Okay. G by D1 is like underlying is kidney insufficiency, right? And Chingusan is more like the in level heat. So this is rather chronic. This is more acute. Yeah, good question though. Yeah. So like a patient has suffering from like G by D1, like insufficient heat is not coming out of like a few months or like a year, right? It's been usually like late, like 50s, 60s, like that, generally developed, like towards the menopause, like that, have a gradually build up this insufficiency. Whereas like a Chingusan is more like steaming bone disorders, like in level heat penetrating quickly to the in level, so more acute. So yeah, so again, the JOOC-V1 is more like a essence and marrow. That means really sick very severely sick due to whatever the reason. Right? So JOOC-V1, and also this is not a formula for using for long term. Okay. Okay. Any questions so far? All right, let's take a break. Okay. Okay, let's continue. So we have LuA-D1, right? Kidney insufficiency, flagship formula. LuT1, add just ways, some wheezing cough, underlying kidney insufficiency. Or we use CHIJU-D1, so kidney insufficiency with some problem with the eyes, like tearing of eyes, diminished vision, the photosensitivity like that. And we have a G by D1, so insufficiency with heat is more excessive. And we have a JOOC-V in, so that more severe in or essence deficiency. In aspect of essence is depleting, so need like a stronger animal product like that. And then next is another two more formula for kidney insufficiency category. Ruth May, can you read this page, please?
Did you call me? Sounds like it.
Yes, go ahead.
Okay.
Can you read?
Thank you. Do I start 75 or 76? Let me see.
75.
Okay, thank you, sir. 75左归眼，熟地山茱萸、枸杞子、山药、茯苓、炙甘草。Indication: lower back soreness, spontaneous emission, night sweats, dry mouth and throat, irritability, thirst, desire to drink, red and dry tongue without coating, thready and rapid pulse. Kidney yin essence deficiency. This is a milder version of the pill analyzed above. It used as a drink rather than as a decoction, which implies that a shorter period of boiling is necessary. Reflects its intended use as a mildly tonifying formula. 76. 大补阴丸熟地黄熟地黄枣黄白知母 Indication: steaming bone disorder with afternoon tidal fever, night sweats, spontaneous emissions, irritability or sensation of heat and pain in the knees and legs, which is sometimes accompanied by weakness, may also be accompanied by coughing of blood or constant hunger, a red tongue with little coating and a rapid and excess at the rear position. This is yin deficiency and flourishing fire with both pathologies contributing equally to the pattern.
Okay, thank you. So another confusing name is Gui-in. So we previously 74 was Gui-1. So in usually means light colored drink. So it's just drink rather than decoction. So it usually indicates lighter or weaker than decoction. So between Zhugui-1 and Zhugui-in, so 熟地山茱萸、枸杞子、山药、熟地山药、枸杞子、山茱, this is the same, but they do have like a stronger herbs like lu jia jiao. Again, lu jia jiao is lurongs, gelatin, and guiban jiao is a guiban's gelatin. So this animal product is again very strong into the essence level. However, Zhugui-in is that's all. There's a Fuling and Ganchao, just harmonizing herb. So not even like a New Xi and Tu Si, they go to the kidney, like kidney yin and kidney yang. So that indicates this is a pretty milder version of kidney insufficiency. And so it's a low back soreness, spontaneous sweating, night sweat, and dry mouth, and the throat, irritability, thirst to drink. So here's a problem. How can we differentiate Zhugui-in versus Luediwang or Zhugui-1 like that? So theoretically, if you look at the Luediwang one, again, I explained that there's a setting of Zhixie, Mudampi, Fuling, they can clear heat in the lower jaw and dampness, so that can compensate those in-nourishing herbs, right? So that's what I mean, like a more balanced formula. Whereas 조괴인, they don't have those this counterbalance. They basically are more like a nourishing, likely nourishing, more for so sudi, kidney, 샤뇨, spleen, 샤주유, the liver. So basically, they are more nourishing aspect rather than sedating, except for fooling, right? So that means that the heat is probably there's not much heat. There's not much heat, and the condition is not that severe. They probably not gonna ask you compare this to the Liu Diwangan like that. But this is one of the in-nourishing herb, and also you have to understand this Jogui 1 versus Jogui in. The in is much lighter. So this is a milder version of the pill. Pill means Jogui 1, analyzed above. It is used as a drink rather than a decoction, which implies that shorter period of boiling is necessary. So if you cook longer, it becomes thicker. So it's not in. So in usually indicates like cook shorter than the normal cooking time. So intended to use a mildly tonified formula. So basically this is all tonifying, right? No sedating. Like again, Liu Diwangan has a set tonifying and sedating balance. Jogui 1 very strongly tonifying. Okay? So not only tonify in, also essence through the animal product, right? And also even a yang aspect of the kidney that supports the in further. But again, this is all your judgment call in the clinic. So it is very hard to give a case. Which one better? 조구인, 류에디왕원, like a 두치wan, like that. But you have to understand when we use this formula, right? And another one, 다부인원. So this is sudi and guiban, animal product. That means it's going to be used very severe case. And 황바이 즈무. So I mean, you don't worry about these things because this is basically how they treat. So 황바이 and 즈무 is what 지바이 디왕 we use clear the indeficiency heat or. So this is steaming bone disorder. So as the Sherman asked, how can you differentiate then 다부인, 지바이 디왕, or 친구산, even like a 칭하오 비해자탕. So they say in the steaming bone disorder, how can I differentiate? Again, those are like a 친구산 or those the 칭하오 비해자탕. There's no tonifying. They're basically clear heat because their main complaint is heat, very excess condition. Whereas this side is with deficiency underlying. I mean, they are of course they are all like in deficiency or indeficiency, but like manifestations of pure excess is those 친구산 or the 칭하오 비해자탕 case. Whereas 다부인환 or 지바이디왕환 is that there's like signs and symptoms of deficiency together with excess. And how can you tell? That is a very difficult part. And so clinically, yeah, you can choose. You can make a decision. Oh, maybe we need to tonify. Well, let's just purely set it first. So usually that's what we do. Like we clear heat first, like but 2-3 days of dosage, just clear heat first, and then after that we change the formula. So yeah, this is I don't think you really have to worry about like how can I differentiate steaming bone disorder. Well, how can I choose? Yeah, it is very hard to differentiate just in the wording. Okay, and then they won't ask these questions. That means that they're not going to ask you this type of questions there. Anyway, so steaming bone disorder with abdomen tidal fever, night sweat, spontaneous emission, irritability, a sensation of the heat and the pain in the knees and leg, which is sometimes accompanied by weakness. So they say something about deficiency here. But the steaming bone disorder with afternoon tidal fever, night sweat, spontaneous sweating, irritability, this is more excess heat due to indeficiency. And maybe also accompanied by coughing of blood or constant hunger. So coughing of the blood is that. Why do you think it's coughing the blood? And what is the constant hunger? This is, again, this is underlying is indeficiency, but this is deficiency fire. So it can be used for diabetic because coughing the blood is indeficiency heat in the lung, right? And the constant hunger is stomach indeficiency heat. So this is severe indeficiency causing this even bleeding. And constant hunger is actually a stomach fire condition, but in this case is more fire due to indeficiency. You may have a similar signs and symptoms. Right? So this is the one because that we can tell this is indeficiency, but heat is also very, very strong fire, indeficiency fire. And the red tongue with a little coating and rapid and excess at the rear position. So that means the lower jaw is in excess with lower jaw heat. But sometimes if you read some case that pulse is under rapid and excess or surging on the front position, like chun position, because that heat goes up, sometimes indeficiency heat goes up, and let's say like coughing the blood or heart palpitation, you may have a surging pulse in the like front, the chun position, because deficiency heat goes upper. Then sometimes your heat is that you can feel those strong pulse on your chun position as well. So this is indeficiency with flourishing fire. Deficiency fire, both pathologists contributing equally of this pattern. That means half indeficiency, half deficiency fire. Theoretically, how can you tell? I don't know. You have to decide. But again. This is they can address both heat and the indeficiency together, but they are just clear heat, but they don't have any like the body fluid metabolism herbs like what zixie, mudanpi, fulling that they can eliminate those damp heat in the lower jaw. So again, this kind of herb, like especially those guiban in there, like lu jiao jiao there, you're not going to use it for a long time. Okay, just use for the manifestation, like even same as qinghao, biejatang, qinggusan, those are all purely sedating. So again, indeficiency has quite a lot. So Liu Diwan, again, this is the most safe and well balanced. Okay, they nourish in at the same time. They clear this dampness and heat due to kidney indeficiency and the sticky nature of the herbs, right? So you can use it for a long time. So basically like a general indeficiency or slightly mild heat side deficiency heat. With a do Qi1, same, but add Wu Weizi, so helping the lung indeficiency. And the Qi Ju D11 is benefits the eyes with underlying indeficiency. G by D11 insufficiency fire. So you have to have the red tongue, rapid pulse, large pulse only in the rear position, but you can have it in the front because the heat is going up, surging up, and you may have a surging pulse too. So yeah, this is all like a variation of Liu Wei D11. So these are constants rather balanced. One thing that we have to carefully is that when we choose G by D11 or Liu Wei D11, because when we use this formula in the clinic, a lot of our patient is more old patient. No matter what, this old patient, yang and yang qi is very critical for their survival. Even though they have a heat, it's still good to have a yang qi there. So if you use too much of these cold herbs, that may damage their yang qi badly and give not a very good consequences due to that. So always be careful, very cautious using these cold herbs when treating this old patient. So this is those 5 is Liu Wei D11 variation, and the other one is pure tonifying without balancing those damp and heat in the lower jaw. So again, Sudi, Shanjuyu, Shanyao, this is Liu Wei D11 is nourished in herbs and goat cheese. And Guiban Jiao, Lu Jia Jiao, this is all very strongly nourished kidney essence of yin and yang. And so the signs and symptoms again is not really differentiation point, rather patient general condition and how this patient is developed into this stage. So again, Liu Wei D11 is rather chronically developed, whereas the Zhuogui one is having some event, some traumatic event, like have this really get sick, let's say have this COVID-19, sick very, very long and deplete all in having this problem, or some AIDS patient like that, so that you can, with those signs and symptoms, you can consider Zhuogui one because you quickly change or quickly fix the problem, because you keep using a nocturnal emission or the spontaneous and night sweating. This means that their pore is open, so they're leaking too much of essence, and the in that is already in its deficiency, and that gives you pretty serious consequences. So that you use Zhuogui one. Okay, this is probably the most strong nourishing in formula, even compared to Liu Wei D11. This is only towards the nourishment. With Zhuogui in, again, in is drink, right? So should change it, the same pill. Yeah. So again, this in is more than it's more drink than decoction. So that means pretty lighter. So same chief herbs with the Zhuogui one, but yeah, that's it. That's all. So this is a mild form of the kidney and liver insufficiency or essence deficiency. And Dabu in one. Dabu in one is, again, what they say is half and half, half deficiency, half excess. So they again have a stemming bone disorder, like bit afternoon tidal fever, night sweat, spontaneous emission. So they emit sperms and night sweat like that, and some weakness. So Dabu in one. Yeah, again, they probably not gonna ask you differentiate a Dabu in one. With Qinggusan like that, it's very hard unless they give a specific clue. So, but try to memorize. This is part of the severe insufficiency heat sign. So that is kind of more deficiency and excess is together. Okay. So any questions of indeficiency? And next one, 衣冠简 and 耳机one. Vincent, can you read this page, please?
衣冠简，头旗子，生地，生麻，脉东，当归 and 川链子 and indication. Hypochondriac and chest pain, epigastric and abdominal distension, and regurgitation, and soreness and weakness of the lower back, dry mouth and sword, irritability, red and dry tongue, shredded, weak and empty, and treading tight, and liver and kidney insufficiency with mild liver cheese stagnation. And 2之1, 女贞子 and 旱莲草, and soreness and weakness of the lower back and the knees, dry and purged mouth and throat, and dizziness and blurred vision, and insomnia and dream disturbed sleep, and spontaneous emissions, and premature grazing or lost hair, a red dry tongue, liver and kidney insufficiency.
Thank you. There are two more indeficiency. It's a lot. 衣冠简 this is more like goat cheese and the sungli. So and the maidong. So pretty much of an indeficiency. With Chuanlianzi is more qi stagnation with the pain. So this is hypochondria and chest pain. So whenever it's hypochondria, there's hypochondria, then it means liver and gallbladder, right? So okay, this has something to do with the liver and gallbladder, epigastric and abdominal distension. So yeah, this distension, another liver qi stagnation. Hypochondria, chest pain, liver qi stagnation. So we know that there's something to do with the liver qi stagnation. As to regurgitation, yeah, liver attack the stomach. Then that's why epigastric distension as well. And then soreness and weakness of the lower back, dry mouth and throat, irritability. So this is typical indeficiency. So yeah, this is just looking at the signs and symptoms, we can tell this is kidney indeficiency with liver qi stagnation. So, and tongue is red and dry tongue, thready. If deficiency is severe, or more weak or empty means a deficiency person, or qi stagnation is more stronger, then can have a wild person. Or like you have a qi position is weak and one position is trimmed out like that. So yeah, like goat cheese, the sungdi, maidong helping the yin, and the dangui, yeah, the dangui kind of give the liver qi to move. That helps the qi stagnation with Chuanlianzi. This is liver and kidney indeficiency with mild liver qi stagnation. So this is rather easy to differentiate. You find indeficiency signs and symptoms and the qi stagnation signs and symptoms together. Then you can diagnose this is liver and kidney indeficiency with mild liver qi stagnation. Okay. So that's 衣冠简. G1. There's only two herbs, right? G1. Again, means two. So this is, remember this one with the premature graying or loss of hair, okay, due to liver and kidney insufficiency. If a kidney insufficiency, you may have a premature graying hair. If liver in or liver blood deficiency, it may loss of hair. So this one is really, you can treat weakness, soreness of the low back and knee. So that is what kidney deficiency, dry and parched mouth and throat, insufficiency, dizziness and blurred vision, insufficiency, insomnia and dream disturbed sleep, insufficiency, spontaneous emission. So basically this is all insufficiency. But would you use URG1 for this? Right? You have LewD1, you have even Jogway1, a lot of insufficiency. But specifically, there's a premature graying or loss of hair is in there, then your choice is URG1. Tongue is red and dry tongue, right? So liver and kidney insufficiency. Okay. So any questions so far? Okay. LepHerb06262024. This endless insufficiency formula. Vanessa, can you read this one, please?
Baihe Gujin Tang. Baihe up to 24G. Zhengdi, Shudi, Maidong, Xuanshan, Baimu, Jegang, Dongwei, Baishao, Gungchao. Coughing with blood-streaked sputum, wheezing, a dry and sore throat, hot palms and soles, night sweat. A red tongue with little coating and a thin, rapid pulse. This is internal dryness of the lungs due to lung and kidney yin deficiency with heat from deficiency. Versus Beimu Gualo-san, more phlegm than dryness and no signs of yin shu.
Thank you. LepHerb06262024. This is a lily. Lily is in there. So yeah, LepHerb, Singdi, Sudi. So yeah, Sudi, we understand there's insufficiency. Maidong, Maimendong is in the lung. Singdi means there's a heat, and LepHerb usually means for some kind of emotional problem as well, and clear heat, and heart too. So LepHerb, Singdi, Sudi is the chief herbs here. Maidong, Xuanshan, Beimu, Jiegeng. So that Beimu, Jiegeng, they all go to the lung. And Dangui, Baishao. So there's a Su Tang is there, right? The Sudi, Dangui, Baishao, except Chuanshou. So we know that this is some with the Singdi together, there's insufficiency heat there. So coughing in the blood-streaked sputum. So your coughing in the blood-streaked sputum is typical. Insufficiency heat ruptures the blood vessel in the lung, just cough the blood. So very like a tuberculosis patient, like that. Wheezing, dry and sore throat, hot palm and sore, night sweat. So the patient is kidney and lung insufficiency with more problem in the lung. So of course this patient may have a weakness of the legs and the low back like that, but the chief complaint is in the lung. Okay, so red tongue with little coating, thin, rapid, thready pulse. So this is internal dryness of the lung due to lung and kidney insufficiency with heat from deficiency. So again, this is a kidney and lung insufficiency, heat, and more like a severe the dryness. So that's why Xuanshan, Sungdi. This is the herb for Jingye Tang, like a nourished water, body fluid herb, right? And this is strongly nourished in the body fluid with clear heat in the lung. So there's a Beimugualosan. Beimugualosan is formula for what? Do you remember this formula? Right, this is dry phlegm. Beimugualosan is actually the same strategy for urchin tongue, but urchin tongue is very dry and hot. Because Chenpi and Bansha, these are pretty dry and hot herbs. Beimugualosan is kind of dry phlegm, so it is phlegm but it's dry. So dry phlegm means that it's like there's a sticky sputum that is dry sticky sputum that is very difficult to expectorate, but there's actual phlegm, and everything is kind of dry. But patient has a phlegm there, so the tongue. So instead of this indeficiency tongue, this patient tongue is actually swollen and the dry, greasy coating. This kind of interesting. So yeah, Beimugualosan is very common for the old patient too, because they have this phlegm for a long time, and your body heat gradually that clear depleting the body fluid. So this phlegm is become very dry. So that's why it's difficult to expectorate. Can be very chronic, difficult to get rid of. So that's why instead of Bansha, they substitute more moisturing and cool herbs like a Beimu and Gualo. So they named it Beimugualosan. So this is very useful formula too for those phlegm patients, because we have like a wet phlegm, we use urchin tongue. It's dry phlegm, well, you use Beimugualosan. Okay. All right. So that is, I think that's all. Right. That's all. That's all for the indeficiency formula. About 10 indeficiency formulas. Again, that's you have to kind of review how can you differentiate between those out of 10. So just try to remember the keyword here, right? UAD11 have like a 3 of 25, 3 set A. So in basic kidney insufficiency. Whereas Duchiwan is the lung. So Duchiwan lung, wheeze, cough, short of breath like that. Chijudiwan, Uchizu, Juha, this is good for eyes. So insufficient patient with eye problem. Jibai Diwan, Jidbai is a Jimu, Wangbai, both are cold and clear dampness by urination. So this is insufficiency, heat, fire. Juhui one, this one is a pure, stronger, and used for the animal product, so more acute, more severe, and used for short term. So the 25 essence and marrow, not just the in. Juhui in is a drink, lighter. So yeah, basically similar thing, but the less severe condition. Dabu in one. So this is like a da, big, right? Big 25, great. In, so this is kind of even steaming bone disorder, very severe fire due to insufficiency with like a same deficiency at the same time. So sometimes have a cough the blood and constant hunger. That means whole three jaw, upper jaw, middle jaw, lower jaw has insufficiency fire. So that's why da, bu, in one. So all over. 一关节, liver qi stagnation with kidney and liver insufficiency. So if you see hypochondria, distension like that with the insufficiency, 一关节. Okay. G1. Means two. This is like a two solstice, summer solstice, winter solstice. So two very hot day, cold day, they pick up these herbs, so they kind of balancing the yin and yang, but they are focused on the premature graying hair or loss of hair with insufficiency. Again, this is just two herbs. They may not have a stronger function of the nourishing all those in things, but they are more specified. It's premature graying or loss of hair. So those things, remember, G1. You gotta figure out how to memorize these names. That's your job to do. And then, Baihe Gu Jingtang is a Baihe lily, goes to upper lung. So this is insufficiency of kidney and lung, cause dryness of the lung. So dry, cough, sticky, bleeding things, and the sore throat. Like this is all kidney and lung insufficiency. This is very much like that. So do you remember like 8 in acupuncture 8 confluential point combination? Which 8 confluential combination point you're going to use? This applicable to this formula? That's correct. They're lung 7, kidney 6. So this is exactly what they use this for. Very good. Yeah. And so Beimu Gujing Tang has no flame issue, just insufficient heat. It's a Beimu Gualusan. This is again a substitute of Urchin Tang. So you can use this, change the Bansha into Beimu and Gualu. Okay. So that is insufficiency formulas. So we have 10 kidney or basically insufficiency formulas. Okay. And next is 25 yang. Okay. Centuria, can you read this page, please?
Shin Shiwan, kidney chi peel from the Golden Cabinet, Luei Di Hongwan, Fuju, Guizhi, lower back pain, weakness of the lower extremities, a cold sensation in the lower half of the body, tense in the lower abdomen, breathing comfortable and leaning against something, edema, urinary difficulty or incontinence, pale swollen tongue with thin white moist tongue, deep and weak pulse, kidney yang deficiency with insufficient fire at the gate of vitality. This formula is focused on the water metabolism due to kidney yang deficiency.
Okay. Now we are 25 yang. So Shen Qi Wan. Yeah, used to be Jin Gui Shen Qi Wan, but yeah, now they just dropped this Jin Gui. So we just say Shen Qi Wan. So this is a kidney qi pill. So yeah, basically this kidney yang deficiency. So just Liu Wei Di Wang plus a little bit of the Fuzi and Guizi. So yeah, this is very very clever. The principle, treatment principle that This is fire, right? 父子鬼子, they put up a fire. But to make the fire, you need the yin, right? You need the oil. So if you don't supply the oil, just put a fire, then you're going to deplete your yin. So if you just only fire without oil, you're going to burn down. That's why, for example, UAD one, you have about 24 grams of sudi like that. However, food is probably 3 grams, very little. Just put up a fire. So you can. Don't put too much of this. This is going to be a serious side effect. So, abundant of the oil plus a little bit of fire. That is good. So this is similar to the Luediwangan, basically a kidney yang deficiency, the low back pain, weakness of the lower extremities, cold sensation in the lower half of the body, tense in the lower abdomen, breathing comfortable in leaning against something, edema, urinary difficulty, and incontinence. So compare this to Sichuan Dabutang. Yes, Sichuan Dabutang, more of a deficiency of qi and blood, have some yang deficiency. So a lot of times the problem when you take the exam, if you see the case, sometimes you're sticking to the just one word there that you are more comfortable with, the cold extremities, spermatoria. Oh, this is yang deficiency. And kind of ignore this part. No? But you have to look at the whole thing. That makes sense for the formula for every individual sign and symptoms. So Sichuan Dabutang is again qi and blood deficiency with a little bit of the yang deficiency. Whereas in Q1, basically kidney deficiency, right? Low back pain, low extremities, cold sensation in the lower half of the body is specifically kidney yang deficiency. Spleen yang deficiency, cold sensation in the whole limbs, and tense in the lower abdomen and the pain because of the cold. Breathing comfortably in leaning against something. What does that mean? Which function is kind of impaired? Which function of the kidney is impaired? Breathing comfortable in leaning against something. So that means so kidney qi, grasping the qi, kidney grasping the qi. So kidney yang is deficiency. It's difficult to breathe in and breathing. So it is comfortable to. So you lay down flat is difficult to breathe while you're sleeping. So you wanna leaning against some like high pillow like that. It's easier to breathe. So that is due to kidney yang deficiency or kidney grasping the qi. And this is another important thing. Edema, urinary difficulty, or incontinence, because this is all kidney, this water metabolism issue, right? Because due to water metabolism problem, underlying kidney yang deficiency, so you have edema, urinary difficulty, or incontinence. So urinary difficulty is difficult to make urination. Incontinence is you cannot control your urination. So basically, it's two opposite or two contraindicated issues, right? So you cannot make a pee, while you cannot control the pee. Well, why is that? Why that happen? why kidney yang deficiency can make a difficult urination or like a frequent urination. Okay, so yeah, because kidney yang deficiency is, we know more commonly kidney yang deficiency cause frequent urination, even up to the incontinence. Right? Cannot hold it because the kidney is qi. Yang means qi, right? Cannot hold, cannot transform. That makes you edema, water retention, or like incontinence. But if kidney functional transformation is impaired, then kidney cannot transform your the urine in the bladder into the pee. Then you have a difficult urination. So this is like a two sides of the same coin. So this opposite situation can take place. So this is this is unique function of the Shen-Qi-1, water metabolism issue. Okay, because they can also deplete like through the Jixie, Mudanpi, and the Fuling, so they can clear those water related the water metabolism problems as well. And tongue is yang deficiency, pale, swollen with a thin white, moist tongue, and the deep and weak pulse. Weak pulse already indicates the deep pulse. So this is kidney yang deficiency with indeficiency fire at the gate of vitality. So deficiency Mingmen fire. Okay. So this formula is focused on water metabolism due to kidney yang deficiency. So not only kidney yang deficiency that causes a water metabolism problem like edema, urinary difficulty, or urinary incontinence, or swellings, like puffiness, with or like a typical yang deficiency, you use Shen-Qi-1. Okay, any questions? Let's take a break, okay? Okay, let's continue. Let's see. Donna, can you read this page, please? Melanie, can you read this, please?
Yogui 1. Restore the right kidney pill. Fuzi, Rogui, Lu Jia Zhao, Shudi, Shangzhi Yu, Shanyao, Gui Qizi, Duqizi, Duzhang Dangui. Exhaustion from long-term illness, aversion to cold, coolness of extremities, impotence, spermaturia, and aching and weakness of the lower back and knees, maybe infertility, loose stools, sometimes with undigested food particles, incontinence, and edema of the lower extremities. kidney yang deficiency with waning of Mingmen fire. Yo Gui Yin, restore the right kidney decoction. Shudi, Chao Shan Yao, Shan Zhe Yu, Gu Qi Zi, Zhe Gan Cao, Du Zhong, Rogui, Zhe Fu Zi indication. Feebleness and exhaustion, abdominal pain, sore lower back, cold extremities, weaker than Yo Gui Wan. Thready pulse, kidney yang deficiency.
Okay. So it's similar to those Zhou Gui one, right? Because Zhou means like again left. This is a right. Pierce means moment means yang, right? So the Huzi Rogui before Huzi and Guizi for Shen Qi one, because they are more emphasize on the like a water metabolism, and Guizi is very effective herb to the transformation of this like a body fluid with the function of the yang qi. But Yu Gui one is more warming. So instead of the Guizi use raw Gui, so more 25 the yang. And Ru Jia Jiao, this is what like a lulong. So antelopons, gelatin again, this is the 25 kidney yang. They still have a Sudi Sanjuyu Shanyao who in aspect, right? Liu Di Wang one there. And Go Cheese, Du Tusis, Du Zhong, they're all like a 25 kidney yang. So they're strongly 25 yang, but again, there's no balance because again, Senchuan has a Liu Di Wang one. That means they have a Jixie fooling Mudampi that they can clear heat and helping the water metabolism. They're not really, they're working on any water metabolism, basically used for exhaustion from long-term illness. So this is a rather serious condition due to kidney yang or even kidney essence deficiency with the waning of minimum fire. So the fire is about, not only deficiency, is about the extinguishing. So aversion to cold extremities, impotence, spermatoria, aching and weakness of low back and knee. So this is all like kidney yang deficiency. But wording here is important, like exhaustion from long-term illness. So this is like a long-term debilitating situation. Maybe infertility, loose stool, sometimes with undigested food particle. There's no heat, no transformation, and incontinence, rather than the retention, because I keep losing, and edema of the lower extremities. So this is, again, this is difficult to just compare with the Shen Qi one. How do I know? Pretty similar, but looking at these herbs here, that they are purely tonifying, warming, and due to exhaustion from long-term illness. So then again, this is, you cannot use this for long term. You just for the about a week, and stop, and then change the formula because it's too strongly warming too much. And the Yo Guiyin, same as Zhu Guiyin. This is a lighter version of Yo Guiwan. So they have Sudi, Shanyao, Sanju, Go Cheese, and the raw wheat foods. But they don't have this like a Lu Jia Jiao type. So not, but again, animal product make this formula very strong, potent. And so feebleness and exhaustion, abdominal pain, sore low back, cold extremities, weaker than you weigh in. So again, when there's a YOU, it is a right, so more kidney yang. ZOU is more kidney in, okay? And they're more tonifying rather than the kind of sedative or balancing. And the person is ready, kidney yang deficiency, weaker than your way1, because it's again in his drink. So that, and then Tang. Mia, can you read this page, please?
Tonify yin and yang, Tang, 2 immortal decoction, Xian Mao, Yin Yang Ho, Bai Zhi Tian, Huang Bai, Zhermu, Dangui. Indication is symptoms of menopause, including hypertension, menstrual disorder, hot flush, sweating, nervousness, fatigue, lassitude, depression, irritability, insomnia, palpitation, and urinary frequency, flaring up of deficiency fire with both kidney yin and yang deficiency.
Thank you. So yeah, this is the last formula in this category of tonifying. So tonify yin and yang both. Xian Tang, Xian Miao, Xian. In Yang Ho, there used to be Xian Ling Pi. So there's 2, means again 2 Xian Tang. And the Ba Ji Tian. This is Ba Ji Tian. In Yang Ho, Xian Miao is all like, they are more like a more yang aspect. And the Huang Bai Jimu, this is again, we have a clear indeficiency heat. Dangui. So they are usually it's a menopause woman with hypertension. This Xian Tang is probably like same time. They are made same time as Tian Go Tang in Xian Tang. They are created in like about 1950s is what they say. So usually both are useful, hypertension. And the tiamagotingin is hypertension due to what? Liver rising. And the Xian Tang is kidney yin and yang deficiency, especially menopause. So just remember that symptoms of menopause, including hypertension, menstrual disorders, hot flush, sweating, nervousness, fatigue. So this part is more insufficiency signs with heat and fatigue, lassitude, depression, irritability. So this fatigue, lassitude, depression is more like a yang deficiency, and irritability, insomnia, palpitation, and urinary frequency is more yin deficiency. So basically more towards the yin, but some yang deficiency with hypertension and the deficiency fire. Okay, so that's why the Huang Bai Jimu is there. Remember Xian Tang for menopause woman, hypertension. Okay, probably on the exam, and they give like that. So yeah, that's all for the 25. Any questions so far? Okay, so since we've been doing a lot of the 25 herbs formulas, sorry. We'll just briefly review. The first 25 Qi, right? So Sijin Tang is a base formula for the Qi deficiency. But the specific function of the Qi, so Li Junju Tang is what Sijin Tang plus Erchen Tang, right? So Bansha and Fuling is there. So the spleen Qi deficiency causes phlegm, having the condition. Then we modify Sijin Tang to Liu Junju Tang, right? So Erchen Tang. Here's another 2. Erchen Tang, we have Erchen Tang, Xian Tang, LepHerb06262024. We have what? We have what? There's another two. Or Miaosan. There's a lot of right? So this is one of the Chantang. Another transformation is but this is like a dampness cause more diarrhea with all signs and symptoms of spleen Qi deficiency, and also phlegm stored in the lung have some like a cough, sputum like that we use Shenning Baijusan. Okay. If Qi deficiency, especially yang middle jiao Qi sinking, we change it to Buzhong Ichi Tang. That we have the Sujunju Tang plus Huang Qi, Singma, Chayu, they're all raising Qi. So that's the Buzhong Ichi Tang, like a raised Qi due to middle jiao deficiency, sinking. Wipeng Feng San, this is protection, so sweating and the recurrent cold. As Wipeng Feng San, you have to be careful, do not confuse with Wipeng Feng San versus Guipitang. I'm sorry, Guizitang. And Singmai San, this is like a Wei Qi deficiency. So lung Qi and Yin deficiency, or even heart and lung Qi and Yin deficiency, more like a gathering Qi deficiency. So cough with sputum, difficult to expectorate, short of breath. This is more lung, Qi and Yin, and the palpitation and side-of-neck sensation, poor sleep. So this is heart. So this is Sungmai San. Okay? So this is typical Qi deficiency formula. Sujunju Tang, Shenning Baizu San, Buzhong Ichi Tang, Yipeng Peng San, Sungmai San. Li Zhongwan and Gui Pitang is Li Zhongwan is more warming, and the Gui Pitang is more Qi and blood together. So their function is all here. And blood deficiency is Sujunju Tang, Su Tang. So what Sujunju Tang plus Su Tang is what? Sujunju Tang plus Su Tang is right, Bajan Tang, right? Yeah. So Su Tang is a liver blood deficiency. So they're like a dizziness, blurred vision like that. So more eyes, nails, the tendons, and uterus, like that. So that is usually like a Su Tang case. So liver blood deficiency, Su Tang. Heart blood deficiency, Gui Pitang. And then Dang Gui Bu Xue Tang is only 2 herbs. Now remember this ratio, 5:1. And Dang Gui Bu Xue Tang is severe loss of the blood. Okay, not just like a liver blood deficiency due to menstrual bleeding like that. This is something like a trauma or childbirth, something happened, lost a sudden loss of the large quantity of blood. So that have very interesting that floating yang. So blood cannot hold the yang is floating up, having this the hot sensation, the muscle and pulse can be floating, like floating pulse like that. So this is Dang Gui Bu Xue Tang. So this is sudden loss of the blood. Xiaoyao Ganchao is muscle spasm due to blood deficiency. So Bai Xiao Ganchao. Two herbs are very commonly used for many other formula together. But remember the muscle spasm. And then, from today we have a Ba Zhen Tang, right? Qi and blood deficiency, Sujunju Tang and Su Tang. With a little bit of like a coldness, we add Huang Qi and the Ro Gui. Ro Gui is again bring back the fire back to the origin, to the kidney, so that you have like this warming. So if you lose the Qi, then the Qi makes your yang a little bit declining. So that's why chronic Qi and blood deficiency or Qi deficiency are leading to this condition. And the Guipitang is a Qi deficiency with heart blood deficiency. So compared to the Bajentang is more liver blood, so they have tendency to more physical issues of the muscle tension, nails like that. But more menstruation. This is more like emotional level, so forgetfulness, palpitation, insomnia, dream disturbed sleep, anxiety like that. So squeepy tongue, another interesting thing that you may remember is bleeding. Inability to spleen to control the blood. The qi deficiency cause bleeding. And Jigan Chao Tang, yes, qi and blood deficiency with irregular pulse. So irregular heartbeat like that. We use this Jigan Chao Tang. Taishan Panshi. So yeah, this is we have Bajentang here minus Fuling, and all like herbs to help benefit the fetus, right? Chudan, Huangqin, Sharon. So yeah, this is the what is prevent the habitual miscarriage, threatened miscarriage. So that is a qi blood deficiency, and insufficiency again. Base is Luidi11. They are well balanced because they're not only tonified, they are sedating, and the dampness and heat in the lower jaw due to insufficiency and the cloying nature of these tonifying herbs. So you can take a long time. Do Qi1, again long, Qiju Dia1 with the eyes, and the Jibai Dia1, heat deficiency, heat fire, and the Jogui1 is more long-term illness, very debilitating patient condition, need 25 for short term. So that you remember the animal product here. And compared to Jogui1, Jogui is like lighter. Okay, so drink. So, but yeah, similar patterns, but this is a light version of Jogui1. And Dabu-in-1 is a steaming bone disorder with kidney insufficiency fire, that both pathology contributing means like insufficiency and fires the equal. How can you tell? It's your judgment. So anyway, at Dabu-in-1, again, you have to differentiate just pure excess condition of like Chingusan type or like Qinghao Biejiatang. They are they have underlying in level heat or insufficiency heat, but they are purely the sedating. Whereas this are like a G by D11 Dabu-in-1, they are the tonifying. Good for that. And Iguanjian, remember, qi stagnation. So hypochondria and distension, right? And G1, so this is kidney insufficiency with premature graying, loss of hair. And Baihegujintang, so this is kidney and the lung insufficiency with lung dryness. So dry cough, dry sore throat, like even coughing with blood-streaked sputum. So insufficiency heat ruptures the blood vessel, can cough the blood. And then 24, so that's 25 yin, 25 yang, and Shen Qi Huan. So again, Shen Qi Huan, Lui Di Wang plus Fu Zi Gui Zi. Sichuan Dabu Tang is Ba Zhen Tang, Ba Zhen Tang plus what? Huangqi and Rogui. So Huangqi, Rogui, so Sichuan Dabu Tang. Shen Qi Wan, Fu Zi, Gui Zi. Instead of raw way using the quiz is that again Xinchuan is more focused on the body fluid water metabolism, and quiz is more effective to disperse those clogging water due to yang deficiency. Okay? So all the kidney yang deficiency with some like edema, urinary difficulty, incontinence, and some breathing issue too, right, due to kidney yang deficiency. And the Yogui again is more like exhaustion from long-term illness. So it's very sick for a long time. Have the yang is depleting. So Yogui 1, Yogui in. And the last one, Xiantang. Xiantang is again kidney yin and yang deficiency is designed for hypertension due to, hypertension for menopause woman due to kidney yin and yang deficiency. This is created almost same time in Tianma-Go Tengin. Tianma-Go Tengin is, they also hypertension with headache of liver yang rising. So, this is for tonifying formulas. Okay, so that's all. So next week we have an exam. So you just take exam, and after the exam we review. No class. Okay. All right. Yep. If your first exam is poor, you have to make it up. Okay. All right. Thank you. See you next week.